Hi, this is Joe Apgar, Chief Operating Officer at Pelotonia, and you are listening to One Goal, a podcast from Pelotonia. The episode will begin in a moment, but during this unprecedented time with COVID-19, we hope you'll consider this important message. For the past 11 years, the Pelotonia community has gone above and beyond to make our mission of accelerating innovative cancer research possible. As we continue our critical work during this time, we must now find additional ways to mobilize our movement and leverage our collective resources for the benefit of so many impacted by COVID-19. We recently announced the following initiatives and actions to help provide support for urgent needs in our community. An initial pledge of $1 million for a new research fund at Ohio State to investigate the impact of COVID-19 on the cancer community and beyond. A new website offering ways to stay connected to the Pelotonia community while providing relevant resources, the latest information, and inspiring content. You can see this at pelotonia.org/rise. A series of community-wide live stream events featuring guests like Ethan Zahn, Dr. David Cohn, and many more inspiring individuals who are sharing their experiences and expertise to help our community. Our team is working to deploy the resources that we currently have in our warehouse to support organizations like the Mid-Ohio Food Bank, YWCA of Columbus, Dress for Success, North Community Counseling Centers, and others who need it. They've already received tents, hand sanitizers, Clorox wipes, and more. And 100% of all net profits from purchases made in the Pelotonia shop through June 1st, 2020, will be donated to support the well-being of healthcare workers at the James and the Ohio State University Wexner Medical Center. These funds will be used to pay for meals, beverages, and other necessary resources for those who are working around the clock to protect the health of others. These are just the many ways we are staying connected to the Pelotonia community during this time of need. You can find more of this information and make a positive impact today at pelotonia.org/rise or click the link in the show notes. Together, we rise.
I just want to say that beyond your commitment of $1 million for this purpose, beyond the committing the profits from merchandise sales for the frontline healthcare providers, but also the Pelotonia's community posting the videos of support for the frontline providers of healthcare was awesome.
Welcome to One Goal, a podcast from Pelotonia. We're a community dedicated to funding innovative cancer research through a 3-day experience of cycling and volunteering. I'm your host and COO of Pelotonia, Joe Apgar. Your journey with us to the finish line begins now. Pelotonia is powered by an amazing community, and it's through research that we will see an end to cancer. We want to thank our major funding partners, the American Electric Power Foundation, Huntington, the L Brands Foundation, and Peggy and Richard Santulli. It's because of them in this dedicated community that all of this is possible. Welcome to this bonus episode of One Goal. Moments ago, you heard about our new website, pelotonia.org/rise. This is an excellent way for our community to virtually come together during this unprecedented time. One of the resources on that website is a live streaming series called Pelotonia Live. Instead of our typical episode today, we're featuring one of those conversations as a bonus episode this season. The one you're about to hear is with Dr. David Cohn and Pelotonia President and CEO, Doug Ulman. Dr. Cohn is the Chief Medical Officer at the James Cancer Hospital and a Pelotonia rider. Not many can say that they have ridden in Pelotonia every year, but Dr. Cohn is a 12-year participant and a longtime supporter of our community and One Goal. During this podcast, Dr. Cohn answers questions from our community about COVID-19, things that we can be doing to help, and a few of his favorite memories from Pelotonia weekend. We wanted to share this audio with you as a way to encourage you, provide accurate information, and let you know what is happening in Columbus, Ohio, as together we rise during the coronavirus outbreak. So with that, here's our conversation with Dr. David Cohn.
David, thanks again for joining us. We so appreciate your time. We know how busy you are given everything that's going on. And I want to just start by asking you, how are you doing? How are you handling sort of everything that you have on your plate right now? And how are you managing through?
You know, it's really a surreal time for everybody across the world, across the country, in central Ohio, and obviously at the James as well. And so being in healthcare, it's really a unique opportunity to see this from the inside. we're doing great here. And I think that that's a really important message, is that right now we're in planning stage. We're caring for patients who have COVID. We're caring for patients who have cancer. We're caring for patients that have cancer and COVID. And all during this time, we're preparing for what we're expecting for an increased number of individuals that come in over the next few weeks that are going to have COVID as well. So we're hanging in here. I think we're actually doing remarkably well overall. And it's great to have this lead time to do all the preparations that's going to keep our community safe.
Do you mind giving everybody in the community just a little bit of insight into your role? I mean, obviously you are a gynecologic oncologist by training, you're a scientist, but you're also the chief medical officer. What does that mean? And sort of how do you spend your days ordinarily and also during this sort of time of pandemic?
You can think about it that I oversee the care that's delivered within the walls of the hospital, within our outpatient clinics as well, and in the community. So overseeing the physician practices, collaborating with our nursing leadership, our staff leadership, and our administrators as well. So it's just, my days are generally spent setting strategy, talking about what we can do to deliver the best care possible at the highest level of quality and the best outcome for our cancer patients. That's one thing I do. The other thing is, working with our community partners, Pelotonia being an incredibly important one. And so I don't forget to do it about a dozen times. Thank you, Doug and Pelotonia, for everything that you all do to help with our cancer research initiatives, because my other job is to collaborate with our scientists and make sure that our clinical mission helps to drive some of our research, and that research circles back and drives what we do clinically.
Well, you do it really well, and having spent time at many cancer centers and across the country and around the world over the years, I can tell you that there is a feeling that you get at the Janes, and I think that starts at the top in terms of the way our physicians and the way the clinical teams take care of patients and their families, and that's not something to be taken for granted or overlooked, and I'm sure at this time it's even more critical. So thank you for everything that you do. You mentioned earlier that you feel prepared. And I think we all have come to realize that we live in a state and in a city that has taken some pretty dramatic actions early to ensure that we do the best that we possibly can. And so can you talk a little bit about that preparation and sort of how you and the team have handled the sort of new, not so normal that we're operating under right now?
We have some period of time before, what people talk about the surge, which is the large number of individuals that are going to be needing medical care because of COVID-19. And so the longer that we have between today and when that surge happens, the larger the opportunity that we have to do all the preparations. And so for anyone who's, accessed the news or listened and seen what's going on in New York, in Italy, as examples, you recognize that these healthcare systems have been overwhelmed. And the reason why that is probably is because that timeline between when they started preparations and when the surge happened was compressed. If a surge looks like this with a lower peak, we're going to have more time to respond in advance to make sure that we have all the medical facilities that are necessary to care for patients. And so the proactive steps that Mike DeWine, our governor in the state of Ohio, has taken have been really, really important, so that today the number of cases that we have is estimated to be about 1/5 of what it would have been had we not instituted these changes just a month ago.
You won't admit this, but you also happen to be a very talented cyclist who has participated in every single Pelotonia, and we're appreciative of that. Our community is filled with patients and survivors and family members and loved ones. What can you tell us about the care that continues to be given and provided to people with cancer today? I know there's been a lot of question about, not having visitors and not having the ability to have sort of more elective procedures, but I know you've told us that people who are diagnosed and who need care are still getting state-of-the-art cancer therapy during this time.
Right. And yes, I deny being a cyclist of any quality, Doug. Here's my take on how to approach the discussion about what care is being delivered to cancer patients. I think most importantly is that care that needs to happen is ongoing. And when you think about cancer patients, cancer care has to keep going because we've got the responsibility to our patients to maximize their survival, improve their quality of life. And so whenever we're thinking about what care looks like, we've got to ensure that we're in a position of guaranteeing that that type of care is ongoing. And so there's a lot of discussion in the news from the Surgeon General and from the governor in the state of Ohio and many states about canceling elective surgeries. And I think it's really important to know that cancer surgery, by and large, is not elective. Things that need to happen, happen. Chemotherapy that is intended to cure patients of their cancer, to improve their quality of life, to diminish suffering. Those are things that still have to go on, and they are going on. But in order to do that, we've got to make sure that we do it in a way that's responsible to our patients, responsible to their families and friends, responsible to our staff, and responsible to the faculty that are delivering this care. So most hospitals around the state and around the country have gone to a really, really hard position of accepting no visitors within the walls of the hospital, except for in really unique situations. As it relates to cancer, for those individuals that are having really difficult conversations at the end of their life, there are visitors that have to be part of those conversations, and that's a very appropriate exception. Short of that, though, there's no visitors in our hospital because we want to make sure that those individuals that come into our system who may have COVID-19 are not infecting our staff, our faculty, and our patients. And likewise, at our outpatient facilities, we also have severely limited our visitors. We're making sure for the same exact reason that we're not in a position where we're going to have an unexpected infection that could limit the ability for our staff to take care of our patients or for our patients to become ill as well. And so we're trying to navigate a really narrow ledge. On one side, it's the outcomes of our patients. On the other side, it's the outcomes as it relates to COVID-19. And so we're walking that narrow line. I think we're doing it remarkably successfully at this point in time. It doesn't always feel good because to have to say to a family member that they can't be there with their loved one when they're in the hospital a couple days after a surgery, or as they're admitted with a complication from cancer or cancer treatment, that's really challenging. And nobody wants to be in that position. But this is our new reality. And this is the trade-off that we've decided to make to maximize that balance between our patients' outcome and their risk for a COVID-19 infection, and their being with their visitors, families, and friends as well. So not easy. And we're all looking forward to the day that we can go back to our previously normal.
Let me give you just one chance to once again emphasize what each of us can be doing today to help not only ourselves and our families, but to help flatten the curve, so to speak.
Hand sanitizer, I think that most importantly, it is the principle of decreasing the risk for getting COVID-19 infection. Because the fewer individuals that have COVID-19, the fewer individuals that will subsequently get it from you. And then that chain will continue. So that's the flattening the curve, having fewer individuals in our community that get COVID-19. So wash your hands with soap and water. It's always around. If you don't have that, consider hand sanitizer for whenever you need it. Distancing. So the physical distancing is really, really important because if you're with your core family, you know them, you've been with them through this entire process. Once you start to get individuals from outside of your core family in the mix, then there's the risk for transmitting infection. If they've been somewhere, they've been exposed, they may or may not have symptoms. You get infected, you give it to your family, they give it to others. And that just continues down the line until we have that peak that we don't want to have. If you're feeling ill, don't see other people. Take care of yourself. Obviously, we need to shop, we need to eat, we need to do all these things, but do it as responsibly as you can. So if we all do our part, then our community is going to be healthy, and then our cancer patients will be healthy, our staff, our faculty will be healthy, and we'll get through this a lot more quickly as well.
Lots of things happening in cancer research, and obviously the Pelotonia community is so committed to that research. What can you tell us about what's going on now looking at cancer research and COVID-19? And is there any overlap or any sort of leads or projects that you're excited about on that front?
There's a lot of things that will improve the health of our community that result from innovation. And so whenever we talk about cancer research, we talk about these incredible innovators that are here at the Ohio State University Comprehensive Cancer Center and at the James. We never thought that we would be in this position, but it allows us an opportunity to kind of think outside of what we typically do. And what we're recognizing now is that there are actually medications that are used for other purposes that might have efficacy or can help in the treatment of COVID-19. And so we're doing that research right now. We're looking at our currently available cancer drugs and seeing whether these could potentially be appropriate for the treatment of COVID-19 patients, so that the chance of somebody who has COVID-19 doesn't end up with a severe complication as a result of it or even die as a result of it. So that's really exciting. I would obviously mention, Doug, is that your leadership in committing $1 million of fundraising from Pelotonia to COVID-19 and cancer research is really spectacular. So this is going to allow us an opportunity to really start to think about things just in this pandemic, but also to prevent future pandemics, or to think about how to more effectively treat viral infections that may occur in the future as well. And so thanks again for Pelotonia for leading that charge and committing those dollars for COVID and cancer research.
Well, happy to do it. And this community, as you know really well, wants to do anything and everything we can to support you and your colleagues. Obviously, we also committed our merchandise sales to support the staff. We know you are working around the clock, and I think we're all waiting to help in any way. So don't ever hesitate to let the Pelotonia community know what we can do. Quick last question, I promise, and then we'll get to the questions that everybody has. But what's your favorite memory from Pelotonia? You obviously have ridden every year. I've seen signs with your name on them, thanking you for saving a family member or a loved one, which must be emotional for you as you ride through the streets of Columbus and beyond. What's your best memory?
You brought up one of them already, and over there in the corner of my office, you can't see it right now, I actually have the photo frame that said, "Dr. Cohn, thank you for saving my life." And when I rode by that sign, it was written, basically in crayon on a piece of cardboard. It was one of the most poignant moments of realizing why I do what I do. And so to recognize that the research that's being done here at the Comprehensive Cancer Center and at the James that actually impacts patients and helps to improve their outcomes, whether it's improving their quality of life, decreasing their suffering, or improving their survival, is so critically important. Sometimes it helps to have that reminder of why we do it. And so that to me is really special. I just want to say that beyond your commitment of $1 million for this purpose, beyond the committing the profits from merchandise sales for the frontline healthcare providers, but also the Pelotonia's community posting the videos of support for the frontline providers of healthcare was awesome. And it was so special to wake up in the morning or to go to bed at night and to see the recognition that we're being provided. It helps us to do what we do day in and day out. So that was really appreciated from the entire Pelotonia community. Thank you for that.
There's a question from one of our community members about ibuprofen. And something that's been in the news reported is that ibuprofen might have some counter interaction with COVID-19 or might make the situation worse. Anything you can share on that front?
Yeah, really early on in the information that was gleaned about COVID-19 was a really small study that was put out that said that ibuprofen, which is a type of a non-steroidal anti-inflammatory medication, negatively impacted the outcomes from COVID-19. And it was thought that maybe it was because of some inflammation, anti-inflammation, some lung injury. Subsequent to that, that was shown to not be the case. And so the answer to that question is there's no problem taking ibuprofen if that's something, or any non-steroidal medications, if that's a medication that you're able to take, that there's no other reasons why you shouldn't and that you need to take it. There doesn't seem to be any adverse outcomes related to a risk of COVID-19 or a risk of complications from COVID-19. But it really does highlight the fact that the pace of information change has been staggering. So what we believe is fact one day can be fiction the next. And so one of the big challenges that we've had is making sure that we're referring to the sources of information that is truth. The CDC, the Ohio Department of Health, to me are some local and national sources of truth to make sure that that information that you might have heard about, just validate that first with a CDC website when it comes to what you can do to prevent yourself from getting COVID-19, what to think about in terms of symptoms or signs of COVID-19, and then also some of the myths that we now recognize are not accurate about COVID-19 as well.
That's great. Our good friend Rich Moore from the Bay Area wants to know if there's any real correlation between COVID-19 and cancer. And I assume he's asking in terms of both the sort of risk and then also the treatment, which you mentioned earlier.
So, this as a provider of cancer care and as an administrator in a hospital, this is really an important component. And so it does seem that there is an increased risk for developing COVID-19 as a cancer patient. What that translates to is just take care of yourselves. Everything that we talked about, hand washing, soap and water, hand sanitizer with at least 60% alcohol, social distancing, and making sure that you're well. These are really important things for anybody, but it's particularly important for cancer patients to minimize their chance for getting COVID-19. And when you say that, it's, anybody that's had cancer isn't necessarily at risk, but those that are currently undergoing cancer treatment whose immune systems are suppressed do seem to be at slightly higher risk for acquiring COVID-19. And so then when it comes to the cancer, the outcomes from COVID-19, how cancer affects that, there also does seem to be an impact where really small studies out of China have demonstrated that patients who have cancer do have a higher rate of complications from COVID-19 than counterparts that have a lower risk. And so it's not just cancer, it's any chronic condition that weakens immune systems, chronic lung diseases as well, solid organ transplant without cancer who are on immunosuppressant medications. There's this group of patients that have a higher risk of complications, and cancer is amongst them.
So another question we got from Bud Abraham is really around our staff at the James and Martha Morehouse and the Spielman Center and the ambulatory centers. Are they receiving the same personal protective equipment as the broader team at the Wexner Medical Center that might be specialized in infectious disease? And sort of how are you taking care of the team?
Yeah, that's a great question. And this is one of those other things that the data changes so quickly. At this point in time, the Wexner Medical Center, which includes the University Hospital, the Ross Hart Hospital, so on, the James, and all of our ambulatory centers, we're following the exact same policy. And these are policies that are put forth by the Centers for Disease Control and Prevention, the CDC. And so at this point in time, if a patient interaction requires some type of personal protective equipment, whether that's a mask, a face shield, gloves, a gown, that's consistent whether it's at the cancer outpatient center or whether it's within the hospital walls themselves, and whether it's the James or not the James as well. So I think that we're all aligned together, following in the footsteps that's recommended by the Centers for Disease Control and Prevention. And we watch every day to see changes that may come up.
Awesome. Great to hear. Jim Coleman has a question, which I think applies to both patients, but also healthcare providers. His question is, how can we help patients who feel isolated right now, who may not be surrounded by as many people and maybe quarantined in some respect? Any advice or guidance both for the patient as well as the family and caregivers?
Yeah, I got a lot of information from Ethan Zahn's Pelotonia Live presentation last week. I mean, I was struck with his comments about what it was like as a cancer patient having received a bone marrow transplantation twice in that isolation, and then to be on Survivor and that isolation, and now to be quarantined or to be isolated with physical distancing where he lives. And so he provided us with a lot of really important guides about what we can do individually if we're at home. And I think it applies to cancer patients as well. So maintaining some type of a social interaction. And I think that in many ways, the social distancing is not the right term. I think physical distancing is really important. Social distancing, this is great social interaction right now. The more we can do this, the better. We are in a really good spot here. There's not panic in our hospitals. We have this preparation time. And so appreciating where we are and appreciating the responsibility that we have to minimize the chance that that peak number is going to be, it doesn't have to be as high as it otherwise would be. Think about that responsibility, go outside and enjoy it and do so safely. And I think we're in a great spot now and we'll continue to be so.
I think this idea of physical distancing versus social distancing is so critical right now. And Pelotonia has always been about bringing people together. And while we can't gather physically right now, there are so many ways that we can engage with our family and loved ones. Let me just end with this final question before we wrap up. And I want to be respectful of your time because you have some very important things to manage. But Kathleen asked, what can caregivers do that are caring currently for somebody who's in treatment, because they are going to the grocery store, they're providing sort of a lot of support, and they want to do so in a safe manner to make sure that they don't negatively impact their loved one?
So that's a great question. And it's something that we hear on a regular basis as well. What can you do as a caregiver of somebody who's at home, not in the hospital, who needs to continue with their daily activities, but they're limited in their ability to do so because of their cancer and they're being careful? And I think that actually answers the question, which is that whatever we can do to help our cancer community that's not in the hospital is really key. So check in on your neighbors, say hello. You can bring them meals. That's not a problem at all. You can help to shop for individuals. If you're a caregiver yourself, be smart about it, which means wash your hands before you go in there. I think that the important thing is that there's been a lot of talk about whether or not bringing things from the outside, whether it's carry out food or whether it's groceries into the house, can carry the risk of contracting COVID-19. And it seems that the answer to that is no. As long as you're doing the things that we just talked about, washing your hands, using hand sanitizer as well. So shopping for individuals who have cancer does not pose a risk. You don't have to leave your groceries or packages outside for a number of days, weeks, or hours. You can do your normal things. And as long as you're washing your hands and making sure that you're not contracting anything from the community, then you're doing everything you can. But just maintaining that social contact with our cancer community to see what's necessary for them is really, really important.
Pelotonia has been the recipient of so much tremendous generosity over so many years. And now's the time for us to all consider how we can support those who have supported us. And that starts with local restaurants and providers and businesses that have been so generous, again, over such a long period of time. So I want to thank you, Dr. Cohn. I want to thank everybody at the James. I hope you will convey to everyone you work with our gratitude and appreciation, both on the work you're doing to help people with cancer, but also as it relates to COVID-19. And I want to also thank our team at Pelotonia, who continue to go above and beyond. We were able to open up our warehouse last week and donate much of the supplies that we had stocked to more than 10 social service organizations. Obviously, the merchandise, the profits that are being invested in the research fund, and there's more to come. But now's the time for all of us to do anything and everything we can to support those in need. And we're beyond grateful to be partners with you, David, and your whole team. And that continues beyond today's chat. So thank you for taking the time, and we appreciate all that you're doing.
It's my pleasure, and truly the partnership is remarkable. I appreciate everything that you've done for the cancer community, specifically the patients at the James, and certainly for the frontline caregivers at the James as well. It is truly appreciated. And we're here for you as a healthcare community, and we're in a great spot. So we look forward to continuing this partnership, and we're in a good place.
That was the voice of Dr. David Cohn, the Chief Medical Officer at the James Cancer Hospital, and Pelotonia President and CEO, Doug Ulman. We hope you enjoyed learning more about COVID-19, how the staff is handling the pandemic, and what you can do to help. We're always grateful for Dr. Cohn's leadership at the James, as well as the rest of those who are on the front lines, especially during this unprecedented time brought on by the coronavirus. Without a doubt, there's a lot of uncertainty right now. But one thing is for sure, there's always a way to make a positive impact. We know that the Pelotonia community will continue to rise to the challenge. If you would like to learn about more opportunities to help those impacted by COVID-19, please visit our website, pelotonia.org/rise, or click the link in the show notes. Before we continue, we want to thank our major funding partners, Huntington, the L. Brands Foundation, Peggy and Richard Santulli, and the American Electric Power Foundation. Here's a preview of the next episode of One Goal.
He says, Dad, I haven't dreamed for a long time. That gives you hope to dream about your future and things. He says, I haven't dreamed anything, but this is the first time after he met Melissa, his now wife. He says, I can dream.
You've been listening to One Goal, a podcast from Pelotonia. The first half of Season 2 will be hosted by me, Chief Operating Officer of Pelotonia, Joe Apgar, with interview and production scheduling by our marketing and communications team duo, Emily Smith and Gabby Bloward. Produced, mixed, and sound designed at the studios of Wessler Media by Vince Tornero. Additional mastering by Joey Gerwin at Orange Judio. Special thank you to all of our guests for being so open and willing to share their amazing stories. Please be sure to rate, review, and subscribe to this podcast, as that will help others hear these empowering journeys. If you're curious about joining the Pelotonia community, please see the link in the episode notes or visit pelotonia.org. That's pelotonia.org.